Good morning, everybody. Welcome to the long weekend's grand rounds. Before we begin, I would like to respectfully acknowledge that we are located on Treaty 6 territory, a traditional gathering place for diverse indigenous peoples, including the Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe, Saulteaux, Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to enrich our vibrant community. Today, we're very pleased to welcome Dr. Giovanni Ferrara, who's going to talk to us about climate change and respiratory disease. For those of you that don't know him, he's a professor and director of the Division of Pulmonary Medicine at the University of Alberta. With a career spanning multiple countries, his research journey has evolved from public health inquiries and evidence-based medicine to rare disease and the utilization of digital tools for patient monitoring, even in extreme conditions like wildfires. Dr. Ferrara has been actively engaged in clinical trials and scientific study groups and has been instrumental in educating and mentoring medical students and residents. Notably, he supervised a PhD student and postdoctoral student in big data analytics related to wildfire smoke exposures. His recent groundbreaking work in digital health and respiratory disease has led to the establishment of the Digital Health Unit at the University of Alberta, dedicated to supporting research and clinical trials in applied digital health, with Dr. Ferrara serving as its medical lead. As you will see in a moment, he's far more dapper than I, so welcome, Dr. Ferrara.
Thank you very much for the nice introduction, Dr. Weck. Oh, actually, you were too nice with me. Anyway, this is my disclosure, conflict of interest, and again, I joined Dr. Weck in acknowledging that we are on the traditional territory of First Nation people. I am a visitor in this country. I'm originally from Italy, and I'm thankful for the opportunities that I get, also because of what was done well before me on this ground. As I was saying, I am from Italy, and that's exactly the region where I am from. It's called Abruzzo, and the only reason I show this today is because we are talking about climate change, and Italy is worldwide renewed as one of the most beautiful countries in the world. We are a country of art, of culinary excellence, and culture. Behind these, there is only one factor, really, which is biodiversity. So this is a snapshot of where I come from. And you can see the sea, you can see the mountain behind. And in between, there are hills where one of the best wines in the world is actually produced. So you see, in 60 kilometers, you have a variety of things that is almost unique. And in fact, in Abruzzo is the only region that can produce Montepulciano. Montepulciano is originally from Tuscany. And it can be produced only in these two regions because the hills, the exposures to the sun, the quality of the minerals in the ground and so on are unique in these two regions, nowhere else in the world. And we can go so granular that even my small town, 2,400 people, has a DOC wine that can be produced only in a little piece of land of 10 kilometers, 10 kilometers square per square. So you understand how important is the microclimate, the number of plants, of animals that are around this environment. In fact, Italy has more biodiversity than China, for instance, which is crazy if you think about the size of the two countries, right? It's where climate change comes. And I want to disclose completely, I don't know anything about it. I actually started to be interested about climate change this year with all the events that happened, especially during the summer. And I worked in Stockholm. And I must say, one day, a few years ago, I was strolling around with my wife in the center of Stockholm, and we saw a teenager sitting in the front of the parliament like, with a sign. My wife said, oh, you know, she was in the news the other day. With my old school style of teenagers, like any excuse is good just to skip school, right? This was Greta Thunberg. I'm sure most of you recognize that. So this is what we are talking about. I think it's useful to have just a refreshment about the definitions basic definitions of climate and climate change, which are the direct global warming effect on health, human health, the indirect effects, and then I want to introduce a concept that I think is very important, the climate resilience. So, definitions. The weather, well, the weather is basically the day-to-day state of the atmosphere. A good day, a bad day, rain, snow, whatever, it is basically what we observe in a very limited time. The climate instead is the slowly varying aspects of the atmosphere, so the air around the Earth, the hydrosphere, the air above the oceans, and of the land surface systems, like where we live. We are mammals, we live on the ground, so we are in the so-called surface atmosphere. And the climate, the world climate describes the variation of weather at a given time for a specified interval of time, seasons, basically, how the seasons follow one each other. Climate variability is another concept. Climate variability is the deviation of the climate statistics over a given period of time, but it doesn't make a rule. For instance, you book a 2 weeks vacation in Mexico during a time that should be totally sunny and nice and warm, and it rains for the two weeks. That's a variability, something that is outside the statistics. It can happen. We can have snow on the Canada Day, I was told, but it's definitely a variation, is not the rule. When we speak about climate change instead, it's really the change in the statistical distribution of weather over a period of times ranging from years, decades, even centuries. So it's a shift of how the climate of the planet basically expresses itself in a long run. And that's where what we are talking about today. Global warming, that's more intuitive. It's the gradual increase in the average temperature of the planet near surface, air, and oceans. Okay, this is also important because when we hear about the how much the Earth got warmer, we're talking about the world temperature, an average across all the year and all of the systems, so oceans, air, and ground. The main, how to say, suspect for global warming is carbon dioxide, CO2. Now, for a respirologist, carbon dioxide means carbon narcosis. Obviously, here we are talking about quantities that are infinitely small, but still having an effect. Now, this is another thing that I discovered starting to read about climate change. I thought climate change was something relatively recent, but if we look at the concentration of CO2 in the air, and there are ways to do it, of course, and stations to do it, that's been changing since a very long time. It is the result of this mismatch of the capacity of basically plants to absorb the CO2 and of activities that instead are producing CO2, mostly human-driven, right? So this is a weather station on the Hawaii. So Hawaii are in the middle of the Pacific. I assume no big industrialization or pollution. And here you see the concentration of the CO2 that has been steadily increasing over the last 60 years. So it started well before what I thought. I thought, you know, in the 80s, maybe we started to have this problem. No, it started much earlier. And the other thing that I didn't know is that the half-life of CO2 is extremely long. It has a rapid decay at the very beginning, but then, as you see here, 33% of the amount of CO2 that is emitted in the atmosphere today will stay there for 100 years. And almost 20% after 1,000 years. So we are talking about CO2 reduction strategies today, but what we are doing today is going to impact us for all our life, basically. And this is just an animation. Actually, it's something nice that the NASA, the National Agency for Space, National American Agency for Space, published a few months ago, but I think doesn't work. Doesn't show that. But anyway, it was the production of CO2 over a year reproduced from a satellite. You can see it, it's on the NASA website anyway, if you're interested. Sorry about that. What about Canada? Well, there are two major stations, one in Ontario and one at the very north of Nunavut. And as you see, the CO2 values have been increasing constantly over time, measured both in Nunavut and in Ontario. So there are several proofs that the CO2 in the atmosphere is increasing. And so is the global temperature of the Earth. So this is the global temperature of the Earth over, as you see, 70 years. And you see the variation. This was measured in different places around the world. And it's basically the same. Since 1948, it's estimated that there's been a variation of 1 degree Celsius increase. How does it work? I mean, why that? We hear about greenhouse effect. So it's what we believe is that the CO2 is basically having this greenhouse effect. The sunlight comes and hits the heart, is reflected for a good part, and then the CO2 is having this greenhouse effect, basically bunching back the energy to the ground. And even the warming of the planet itself is producing infrared radiations that again are bunched back to the ground. So that is increasing the overall temperature of the planet. To be fully transparent, there are scientists who actually object this theory of the greenhouse gases as the main contributor to the global warming. They say that we had glacial eras, the planet has changed several times, the climate over billions of years of its life. But everybody recognizes at least the contributory factor of the greenhouse effect, which is important because otherwise we will not have anything to act on. And this is what is going on in Canada. Now, Canada is warming up faster than the rest of the planet. This is, you see the globe. We are talking about surface atmosphere now. So the environment above the ground. This is the planet. You see here, this is Canada. And then you see the Arctic zone, so Nunavut and Northwest Territories. And that was also interesting to understand because basically what happens with the global warming, the surface that is covered by snow is reduced. The snow reflects very well the light of the sun, and that avoids that basically the surface gets warm. Reducing the snow, more energy is absorbed, the temperature goes up. So you see that the biggest variation is actually in Nunavut because of the glaciers and everything are reducing, which means an extreme change in the microenvironment over there. So we think about the white polar bears, but of course there are people living in Nunavut and the ecosystem, and so it's changing. So let's go and now speak about medicine because that's what I wanted to do. So what are the direct effects of global warming on health? This is a very nice review, a series of reviews actually on Lancet about climate change, and it explains the effect of hot temperature of the human body and why they can be really detrimental to our health. So when we're exposed to heat, we basically have a vasodilation in our skin with what? That's to basically lower the core temperature of our body, right? We shift the blood to the skin with sweat in a way to let the sweat evaporate and take away energy from our body. And that's a physiological compensatory reflex, basically, right? In extreme heat or in the presence of health conditions that are reducing the efficacy of this mechanism, what happens? Well, we shift the blood somewhere else. So the volume, the circulating volume in the main vessels will reduce. So the blood pressure will go down. The heart will need to strike faster. So we'll have a tachycardia. And of course, if there is a mismatch between the oxygen demand of the heart and what is provided by the lungs, we might have an ischemia. This is affecting, obviously, the people that cannot regulate their temperature in a very effective way. So very small children, elderly people, people with disease, especially cardiorespiratory disease and neurological disease. Okay. If this, how to say, the compensatory reflex doesn't work well, we will have areas of relative ischemia in the body, producing endotoxins, responding with cytokine, chemokines, and inflammatory responses, leading to organ damage. I would say, as a respirologist, when we are exposed to this temperature, another reflex we have is to increase our respiratory rate, which is putting extra stress on the architecture of the lung. If disease, even worse, so mismatch ventilation, perfusion, higher that space by breathing. So you can understand this can become very easily a snowfall that can lead people to the hospital and even to die for extreme temperature. In fact, here are the main causes of death for hot weather or heat extremes: cardiovascular, respiratory disease, cerebrovascular disease. And of course, there are aggravating factors like use of drugs, use of alcohol. Social disadvantaged people, of course, are more exposed to this phenomenon. So, and as you see here, so this is a meta-analysis of all the causes of death during extreme temperatures. It actually takes into account also deaths for cold temperature, but we are talking about heat extremes right now. So you see here, cardiovascular disease, respiratory disease are the second cause of death during those events. These studies, these meta-analyses are always a little bit criticized because, for instance, this study selected at the beginning something like 4,800 papers, and at the end they ended up using 68 papers for the study because not fitting the criteria for inclusion and so on. So there is probably selection bias, publication bias, but I think this meta-analysis is actually pretty good because it's very stringent. We went really considering at least 3 years of observation during summers and winters, having all the codes for the disease, the ICD-10 codes, and so on. So, and as you see, the risk for diseases here, for respiratory disease, increases by 2.3% for every degree Celsius of increase of the temperature. Is it only theory? Is it really something we should mind? Well, this is a study that was published on Nature Medicine in July this year. And it is about the so-called heat-related mortality in Europe, across Europe, in the summer 2022. Now, if you see here, this has been the temperature, the average temperature across all Europe over the last 30 years or so. So there was a period of relative stability. It was called the big hiatus. And then suddenly around 2014-15, the temperature started to rise every single summer. Okay, so 2022 was considered the hottest summer ever, was already beaten by 2023. So the data that I'm showing you are probably already old. But in this graph here, you see the average temperature from the 1st of June to the beginning of September across all Europe from 1980 to 2020. So it's an average temperature across the whole continent over 40 years. And you see, okay, the peak of temperature as expected is around mid-July, mid-August. This was 2023. There was a variation, an excess in warmer days up to almost 4 degrees Celsius, okay? So the researchers of this group gathered the data of mortality from the Eurostat, which is the big database on statistics in Europe. And they went to see the excess mortality during those days. So from June 1st to September 1st, 16,000 people died more than expected across the whole continent, okay? Half of them, 38,000, died between July 11th and August 14th, that's exactly around this peaks here, okay? So there was a heat-related excess mortality of a few thousand people. And 18,000 people died in Italy for heat-related causes, okay? When they went and analyzed, well, who is dying? Of course, the most affected people were elderly, over 80, and dividing by gender, actually, women were dying more than men, which sounds quite interesting, but I think since most of the deaths anyway occurred in Southern Europe, first of all, women live longer than men. So it's possible that most of the octogenarians people were women. And then there are those who take care of the families. The husbands are often diseased, so they really often also caregivers for this people. So probably are more exposed for that. Here, this is the mortality rate occurred during those 3 months, basically. So across Europe, 144 deaths per million, again, in 3 months. Italy, Greece, Spain, Portugal were the most affected countries. You see here the heat abnormality, say the red indicates where the temperatures went up, basically, and compared to the historical data. And here where people died, okay, died the most. Actually, it's interesting, also the data that are reported in this paper show that a number of people under 65 died in southern France, this area. And that's because probably they were not prepared to face this heat. In Italy and in Southern Europe, temperature had been quite high over the last decades. So there's basically no household without an AC machine today. That's not the same in France or in England. Even there was a recent paper from England reporting an heat-related excess mortality that was never seen before. And this is a prediction that the authors do based on a linear regression. These are the heat-related excess mortalities over the last decades. This is 2022. And the authors very simplistically maybe say if we don't do anything, we can expect 94,000 deaths for this phenomenon by 2040 and up to 120,000 by 2050. There are other models, of course, and nowadays there are a lot of epidemiologists working on this climate change questions. There are models that are more complex and probably more precise, but we are talking in this case about predictions. So we've been listening about predictions for COVID for the last 3 years, right? So a prediction is the probability that an event will occur given a number of factors around this event and given a certain level of impact or effect of the very different factors around it. So when the epidemiologists do study these conditions, like in climate change, we take into account the current population of the areas, the expected growth of a population, the expected senescence of a population. Many elderly people will be there. And then, of course, the trend of the temperature, the trend of the CO2 and so on. And they try also to advocate for change, especially for the carbon footprint, carbon footprint, saying, if we continue like this, the temperature will just continue to rise. We'll be for that. So this is, as I say, the prediction. You see that it has 3 scenarios. So reduction of the CO2, stay as it is, and no action, it will just increase. So to make it short, you see here that if the global warming will continue as it is today, we can expect that the heat-related mortality will just increase in areas like Central America, Southeast Asia, Southern Europe, South America. Okay, the blue line is about the cold-related mortality, which is expected to decline. For instance, in North America, it's called a snow zone because it's covered by snow for many months during the year. The cold-related mortality should go down. It actually should equalize the increase of the heat-related mortality. Okay, but to give you an idea of what can be the impact of this is another paper, again, same story, predictions and so on. This is Middle East and North African region, which is pretty populous. There are a lot of people living in that area. So if nothing changes and will continue like this study shows, for instance, that in a country like Iran, down here, the heat-related mortality per year will be equal to 129 deaths per 100,000, which is even higher of what is the tuberculosis mortality in many sub-Saharan African countries right now. Just to give you an idea. So you can expect that if we are in these scenarios, certain areas of the planet would become completely inhabitable. And of course, there will be a number of phenomena of migration and different things. But I just wanted to give you an idea why it is important to consider, as a physician, the hot days, especially for the very, very vulnerable persons. Again, elderly, young children, and people with disease, cardiopulmonary, cardiorespiratory disease, first of all, and neurological disease. Full disclosure, and also I must say, my presentation is fully oriented to adults. So I'm an adult respirologist. Must say that there are pediatricians in this university like NX who are doing a wonderful job about climate change and the impact on children instead. And it's a very, very important chapter as well. So indirect event. So May 13, I was in Italy. It was the wedding of my dear friend Nicola Murgia. I was here a couple of years ago for a ground round on the ATS statement on occupational disease and respiratory disease. 3 days before, it rained quite a lot, but it was calm. We had a nice party. And this was after 4 days, the same place. It is close to Bologna, so it's not close to the sea. It was completely flooded. And I'm not here to speak about disaster medicine. It's not my area. There are other people that can take it. But my question then became, okay, we had an extreme weather event with the flooding. What is going on with my patients, or in general with the population after that? And there are a few studies showing very clearly that, especially after the first week from the event, probably when the rescue efforts have already done everything that they needed to do, there is a steep increase of the emergency room visits. And one of the main causes is respiratory infection. This is a study from Japan, and this is a study from the Netherlands, actually. Of course, there is a change in temperature. Probably with heavy rains, there is a drop of the temperature during those days. Another factor that is actually under scrutiny is the fact that with overfloodings, also this sewage system is overflooded. So there are a lot of bacteria coming in the environment from that place. And so you see here, there is a significant increase of acute gastrointestinal infection and acute respiratory infections. Okay. Another factor that is not taken into consideration in the very first days, that of course all the efforts go to rescue human beings, but also animals are often around in this area. This is a very strong agricultural area, was a very strong agricultural area. So you had dead bodies of animals left on the ground for days and days and days. They had actually a cholera alarm at point because the water was being contaminated. Okay. And then I came back to Edmonton. And this is what I saw on May 20 when I landed in Edmonton. Wildfires, heavy smoke. So as we know, I think everybody knows by today that 2023 was the worst season ever for wildfires in Canada. Actually, it was estimated in September 15, this is Wikipedia, that are reliable, that 170,000 square kilometers were burned by the fires. To give you an idea, this is more than half of Italy, aside again. And we have experienced a number of days of smoke that, frankly, I've never seen before, So what is the effect of this phenomenon then on human health? Well, again, this was September. There were still in September 81 active wildfires with a few not under control. Total for over the year, more than 1,000. This is yesterday. We still have wildfires active in the province. And what happens then? Then, of course, the smoke goes into the air without even, going back to the 19th century, the days where, there was a week in London. It was industrialized, coal-based. So we had a low pressure for a week. So all the smoke stayed in the city, and hundreds and hundreds of people died of asthma during those weeks. But when we talk about wildfires, we talk about wood burning products. And it is an aerosol of a number of things. I tried to ask my friend Nicola, who published something about this with a group in Sweden, what kind of molecules should I look for? What kind of compounds should I consider for studies to look what can be the effect? His reply was, well, it depends on what kind of wood you are burning, because not everybody they have different concentrations of minerals, humidity, depends on the temperature of the fire also. So it's almost impossible really to standardize the exposure. It's a little bit like with cigarette smoke. We have studied cigarette smoke for 50 years. Still today, there is not a single compound that say this is cigarette smoke. Anyway, this is the effect of the exposure to this wildfire smoke. This is another meta-analysis. Again, same problem as before. Huge number of studies, but then very few studies fitting the criteria. Again, stringent anyway. Again, problems with defining the exposure, problems with defining how do you define the exposure, because it's something to have a weather station at 1 kilometer, something else is 100 kilometers. Definition of outcomes and so on. But anyway, there is some evidence here. All-cause mortality, very strong, even considering just smoke in the air. What is a smoky day? I'm not sure, but a few studies were designed like that. Particular matters 2.5, PM 2.5, which is widely studied as well. We'll speak about it. PM 10 as well. If you pull all the studies together, most of them are anyway already significant, but you see that the overall mortality for wildfire smoke is increasing by circa 1.3 folds. Okay. Particular matters, again, PM 2.5. Why we look at those compounds or aerosols? Because they're defined by the size of the molecules. And we know that under 10 micron, we can inhale the particles and they get to the peripheral parts of our bronchial tree. When the particles are under 3.5, they get to the alveolar space. So they really get into the deep lung. Now, this slide is from the government of California, actually. Again, I tried to understand what is really PM 2.5, for instance. Again, it depends on where it comes from, what is burning, the quality of the materials, the winds, everything. So there's just a classification we use based on the size of the molecule, saying they will get into our deeper lung. Well, this is the effect on admissions for respiratory disease. So this is asthma. Not surprising. Number of exacerbations of asthma related to wildfire smoke exposure. This is pneumonia. Actually, should have been COPD. Sorry, I took the wrong figure, but the COPD had a similar diamond at the end, like with asthma, and even the risk of pneumonia is increased. Although you see here is at the limit. And I think that it is common sense for what we have seen at our ward during the summer to say we had a number of chronic patients exacerbating outside, you know, the season of the viruses or of the cold and coming to the hospital. Our ward was quite full during the summer. So these are the trends of PM 2.5 in Alberta. You see they go to 2021. The data for 2022 should be released next week. You see these are the baseline trends. And there are a few peaks around here. Now this is 2016. And this is Fort McMurray. Does it say anything to you? Because we wildfire Fort McMurray. So you can expect in 2023 now to see probably a few more of these peaks. And probably it is a good study case to look at. Now, I work especially with interstitial lung disease, pulmonary fibrosis. And I think it's a very good model to understand the effect of the wildfires or of pollution in general on respiratory disease. Now, this is a patient with idiopathic pulmonary fibrosis in phase of stability and in phase of IPF exacerbation. So an IPF exacerbation is a very rapid worsening of the conditions of the patient with increased shortness of breath, oxygen demand, and increased ground glass opacities on the CT scan. It's one of the most dramatic events we have in pulmonary medicine, because 30% of these patients will die at the hospital, 30% will die within 6 months, and the rest will be on oxygen for the rest of their disease, mostly. So it's a very rapid progression of the disease. And still we don't know why. We know that surgery can trigger these events. We know largely that pollution and quality of the air can do something. And now we have a number of studies showing also that events related or similar to wildfire smoke exposure can trigger these events. So this is a study on a cohort from South Korea, retrospective, around 400 patients. They had 75 exacerbations, so events like the one I described to you, and they went back and see if the pollutants in the atmosphere were somehow related to these events. And they found a very strong correlation with ozone. Ozone induces a very strong oxidative stress in the lung. It's actually the time lag for something like this is around 6 weeks. So from the exposure to the admission to the hospital for acute exacerbation. And it was significant both for the mean exposure, the cumulative exposure, the peak exposure, the day that was the highest exposure, or if it was repeated. They measured in these 3 different ways, and they were all significant, as a strong correlation with progression to acute exacerbation. This was in the 3 weeks before the event. NO2 the same, not so much for PM10 and PM2.5, okay? So this was the first real demonstration that pollutants that can be also acutely introduced in the atmosphere with events like wildfire can trigger very severe events in patients with pulmonary fibrosis. This is another study from France, again, retrospective, and only on 192 patients. So a very small cohort, well-defined, but very small cohort. Again, we went back to see the exposures to a number of pollutants produced by combustion of oil, gas, and wood, and the association with the occurrence of acute exacerbations. Again, same result as the first study. Ozone, an increase of 10 microgram per square meter, inducing acute exacerbations of IPF exactly after 6 weeks from the exposure. And also, they went and looked for the long term, saying, okay, which of these pollutants do correlate with mortality? And in this case, yes, PM10 and PM2.5 were strongly correlated to this, with an increased risk of dying for IPF in this case of 2.0 for every 10 microgram of PM10 per square meter. So increasing risk with increasing dose. This is the last study that I present about this, and it is actually recent. It's, again, a study matching measurements obtained by satellites, by stations on the ground, and the course of the disease in patients with fibrotic interstitial lung disease. So it's very, from a technological point of view, is extremely, how to say, elegant. What we found again that in terms of mortality, overall mortality, following the patients from diagnosis to the end. All these pollutants were correlated with the mortality, this one especially, NO2, oops, sorry. And the other one here. But also that people living exposed to higher cumulative doses of all these pollutants, and again, we're talking about the PM2.5, nitric dioxide, tetroxide, and nitric sulfur, sulfur dioxide that produced also during the wildfires, and all these patients had a faster progression of their disease. So higher was the dose of exposure to these pollutants, faster the disease would progress. So again, it's I don't know if I can say they're really demonstrating things because the studies it has some flaws, but definitely we can say that whatever is in the atmosphere is interacting with our lungs, and especially in extreme point exposures, we should really mind about the health of our patients, like in wildfires, right? Or days of extreme pollution in the air. And now I think this is very important for us as physicians. So the concept of climate resilience. So WHO, European Union, even the American agencies are all saying, okay, climate change is here, cannot be, scotomized. It is causing troubles to many sectors, from economy to agriculture to, again, biodiversity and human health. We need to have systems to basically alert the population and try to mitigate the effect of the long-run effects or of the acute effects related to climate change. You see, they have very, very complex diagrams and systems. I personally like very much this definition. This is an American NGO, very active, very influential on the United Nations, for instance. So climate resilience is the ability to anticipate, prepare for, and respond to hazardous events, trends, or disturbances related to health. So my question for you is, if I showed you that these events can affect the health of our patients, actually leading them to potential death, should we be doing something in advance? Should we prepare them, yes or no? I will say that everybody will say yes, right? Should we try to do something? Now, again, the evidence about what can be done is very, very thin. So this is a systematic review performed by the CDC, Centers for Disease Control and Prevention in the United States, about different systems to purify the air in days of, again, even smoke related to wildfires or pollution. All the studies are just measuring the effect of, again, the air purifiers on the quality of the air, assuming that if a patient stays at home, close the windows, turns on the AC, use the purifiers, might have a protective effect, okay? And in fact, these are the only recommendations that we have right now for our patients, especially during wildfires, right? So stay home, close the windows, turn on the AC, try to avoid physical activities, because you don't want to stress your system, and so on. What is my take on this? Well, I mean, we need to raise the awareness, first of all, because patients and our physicians don't know, So we need to say these are events that are very dangerous. You have to take care of yourself. You have to provide some guidance to the patients and so on. We need to look for the local data as well. We have wonderful databases here in Alberta. We should look at that, I would say, almost in real time to predict what is the burden of these events on the healthcare system and what we should do about it. Extremely important as a specialist, optimize the treatment of all respiratory chronic conditions. Still today, unfortunately, in In countries like Canada, we see people dying of asthma. And that's not acceptable, right? You can imagine a patient that is treated with only salbutamol and going through a week of wildfires. You know, I am myself, I have a mild asthma. The only 2 times that I used an inhaler over the last 5 years were in 2019 for the wildfires and this summer for the wildfires. The only times. So very important. We have to prepare the patients and provide the best treatment. And then provide guidance, of course, and then research. And at this point, I would say, do we have a few minutes more, Adrian? Yeah. So you heard a few weeks ago also Ross Mitchell talking about things that are really revolutionary, right? So we are at the dawn of the industrial revolution, big data and artificial intelligence. So we are individuals. We produce everyday data that are interconnected and even influenced by the data in the community or by the interaction that we have with other people or with other systems, even with the so-called data sphere, which is the repository of data in different databases like our bank, our healthcare system, or you name it, you know, social media. And then there are around us satellites, computers, telephones, whatever, that are using this data to provide services. Does it feel science fiction to you? Well, have you ever used Uber? Uber connects you, geolocation, with another driver in your area through a satellite, computes the itinerary, the shortest way for traffic, connects your wallet to their bank, and provides the service, right? So it's not science fiction. DoorDash, same. A restaurant, a person, a driver, the bank, the menu, preferences, all together, and so on. Tinder. I never use Tinder, I swear. I never use that app, okay? But I was told it works this way. So this is a way people are thinking to use to start to respond to climate change challenges. This is an Australian group, actually, that created an app for every sort of telephone, basically smartphone. And as you see, it has levels of PM 2.5 temperature, grading to inform the patients, and even the level of pollens. Now, in Australia, one of the major problems with climate change is that the pollen season extended for a couple of months. So they have a number of patients with severe asthma there, and that's a problem, right? So by way of informing the patient, they hope to reduce the exposure. And by the way, the same app can collect prompts and prems. So give back a feedback to providers about what to do. And this is a study that we are performing here. Take it with a pinch of salt because these are very, very, very preliminary results. But basically, this is a cough counter, digital cough counter, and the exposure to PM 2.5. So you see here the peak exposure to PM 2.5, and here is the cough of the patient increasing just after that with a lag of 14 days, and the fit is relatively good. Okay, so it's theoretically it's possible to provide guidance, information to a patient real time, their location about what is going on, check their condition, and even maybe trigger pharmacological interventions. And this is probably, you know it, the University of Engineering here at the University of Alberta actually sent a satellite in the orbit to monitor the forests in Canada to predict the risk of wildfires. So again, might be possible even to prepare in advance people to these risks. And finally, very, very shortly, the Canadian Thoracic Society has been one of the most active in advocating for, again, climate change and climate resilience. Actually, this is the first statement from a respiratory society that I've seen targeted to a specific problem, which is the carbon footprint of the inhalers. So spray inhalers contain propellers that have a very strong greenhouse effect. Actually, one canister of Ventolin, for instance, is supposed to produce the same effect of a trip with your car of 130 miles. So you can imagine for how many hundreds of thousands of canisters in Canada are used. So basically the recommendation is try to use powders instead that do not have this problem whenever possible. Of course, keeping in mind the safety and the efficacy of the patient. So I hope that it was useful for you to have a few notions about the definitions of climate change and warming, an idea of the direct effect of the global warming and the indirect effect of the climate resilience. The concept of climate resilience, I think, is very important. And these are two readings that I really would recommend. This book is actually available in our library online. Thank you.
Thank you very much. We've just got a few minutes to questions with anyone in the audience. I need to tap this to amplify you for those people online, or perhaps you could take any questions if there are any online.
I think presenters are currently muted. Any studies on how wars have contributed to global warming? No, I don't think. I didn't see anything. Of course, I would say, what is the contribution of global warming on the outcomes of wars more than the other way around? Of course, you have explosions, you have production of several pollutants. They are unlikely to have a global effect, definitely a local effect. If we think about the war in Ukraine, for instance, one of the main fears last year was the winter, right? They could go through because it was not that cold, maybe. If we think about even what is going on in the Middle East, or what's been going on in the Middle East over the last 15 years after the rise in what was called the Arab Spring and so on. There was a tremendous flooding in Libya a month ago where 10,000 people were reported as dead in 2 days. So again, I take war is an expression of instability, of social disadvantages, whatever. Of course, the people that are troubled by war are even more susceptible to all the other events. So that's definitely something we should keep in mind and advocate for globally.
You talked about some of the recommendations for people with current respiratory disease in their current houses. Are you aware of any architectural design innovations which are designed to improve resilience against climate change as we're experiencing it at the moment?
I'm not aware of that, but you can control the temperature of your house with Google, Amazon these days, right? And if I think about your patient, for instance, your patients with Alzheimer or dementia, having an automated system that will take care of at least of the microenvironment is probably very important, right? So I've seen myself patients declining very often during the summer in Southern Europe because of
family care partners controlling environments of their older adult houses. Automatically. Okay, it's probably time to pack up. Thank you very much again for a great contribution, and have a good long weekend, everyone. And thank you.
Thank you.